So, I'm going to be talking about publication bias in this article called Cognitive Behavioral Family Intervention for People Diagnosed with Severe Mental Illness and Their Families. So, in this article, they were examining mental illness in relation within the context of families. Uh, so, when they did their initial search, they had a lot of records show up, but there were a lot of duplicates, and then there were some that were screened, and then 20 after inclusion and exclusion criteria, there were actually only 4 studies that remained. So this is a meta-analysis of 4 studies. And then some of the outcomes that were assessed were overall positive symptoms, delusions, hallucinations, overall negative symptoms, general psychopathology, and insight. And here you'll see the studies that were included. Very, very, very small amount of studies for this meta-analysis. So with that being case, publication bias is of great concern with this study. So let's delve into what happened. So they assessed publication bias using the LFK index. Um, uh, so when we look at what the results were for the publication bias, the LFK index was calculated and resulted that significant asymmetry of plots was noted, suggesting that publication bias existed. Tim talked about how when assessing publication bias, we want to have symmetry of our plots, and lack thereof is a concern. And when there's asymmetry in certain ways, it indicates publication bias. So that was the case with this meta-analysis. So there's a good chance that there's not much research on the topic simply because there were no results. And especially with this sort of topic, cognitive behavioral therapy, for people who are experiencing severe mental illnesses. In my mind, it makes a lot of sense that cognitive behavioral therapy would be much less effective when people are experiencing severe mental illnesses. It's hard to really. Cognitive behavioral therapy in a lot of cases helps with more cognitive distortions rather than maybe full blown hallucinations. I'm not like a clinician, but that was my understanding of cognitive behavioral therapy, and I know that uh, um, symptoms such as hallucinations and delusions tend to be much more difficult to treat in a therapy setting than less severe mental illnesses. And so, in my mind, it would make sense that people probably have studied this topic but come up with no results because these illnesses were resistant to that sort of therapy.